be interested in standing as a member of parliament, you never know. So this is an opportunity for you to learn the corners of these institutions, and once you really develop interest, you will know where to begin from. Some minutes for you to tell us what is good in Imbara.
Yeah, thank you. Thank you, Honorable Chair, and the honorable members, plus my colleagues from Mbara Regional Referral Hospital. First of all, we are delighted that you invited us for this important meeting. And again, we are very comfortable with the welcome you've given us. Yes, we come from Mbara Regional Referral Hospital. Actually, it supervises 11 districts and 1 city. You allow me give you small or brief history of Mbara Regional Referral Hospital. This is a very unique regional referral hospital compared to other regional referral hospitals. In 1989, Mbara University of Science and Technology started, and the same hospital was actually adapted as a university teaching hospital. And for that matter, it was shifted from the Ministry of Health, and it got absorbed under the Ministry of Education. It stayed there until 2005. At that moment, it appeared too expensive for actually the Ministry of Health, not the Ministry of Education. They pushed it back to the mother ministry, that is the Ministry of Health. And in that period of 10, 11 years, it missed out of very many opportunities, including the structure, including the medical equipment, workshops, and very many other things. So when the rest of the regional referral hospitals were expanding, this one was hidden under the Ministry of Education. Now, surprisingly, today, that's the hospital that is actually running 42 units. That is the usual common services, plus specialized services, and super specialized services. We are lucky to be offering super specialized services because of our sister institution, which is Mbara University of Science and Technology. This is a hospital that originally was meant to be of 370 bed capacity. But because of these services, I'm telling you, the population has overwhelmed us. We've shifted from that level. We've come actually now to 450. Unfortunately, there is no physical expansion. We've got forced now to narrow spaces between patients' beds. Occasionally, we admit under these same beds. You find a patient is on a certain bed, and now another patient comes, gets forced to go on the floor, or even sometimes under the colleague's bed. We've had patients in tents. We've got a challenge, as I've told you, that this is actually a regional referral hospital, and that makes us, we don't access some essential medical services from our national medical store because of our status. As much as we are providing unique services like neurosurgery, urology, cardiothoracic surgeries, and fertility clinics, when we want sundries and other supplies, they say, no, you actually serving beyond your capacity. What you're asking for is meant for a national referral hospital. We are saying, look here, we are doing dialysis, we are doing cancer services, we are duplicating exactly what is being done at our national referral hospital. That has been a dilemma. Deep down there, we've manipulated, we've tried to make different avenues to see how we can access the medical supplies. One, we have a team that continuously pushes the national medical store. But again, we've jumped out of our box. We've included now, we have collaborations and other partners, and mainly we have the University of Duke, and we have Bethany Kids. they have come in handy. They have provided actually unique surprise we would otherwise not access. Honorable Chair, I want to stop here for now. I'm sure we are here together, and I've come with my team. We come with open hearts, open minds to be guided, and we see this place actually, Budgetary Hospital improving from where it is to certainly where most of us would wish it to be. Thank you.
Thank you, Accounting Officer. What is your population?
Oh yes, apparently the last census, I think they quoted, was it 4 million? Yes, it was 4-point-something millions.
4-point-something?
Yes, and maybe what I forgot to tell you, we've got a challenge. That's a regional referral hospital, but the sister regional referral hospitals like Kabare, Fort Potro, Masaka, they still refer to us. And why? It is because of the specialists we have. It is because of the high standard laboratories we have, which actually accredited internationally. Now we are lucky. If investigation is done in Imbara Regional Referral Hospital, those results will be accepted actually in America, Europe, and everywhere. And more so, we've got an MRI in that region. So really, the sister institutions of the same level get forced to refer to us. Thank you.
Thank you, Director. Honorable colleagues, we take note of those few challenges that are faced by the Mbarara Regional Referral Hospital. We shall see how to incorporate them in our report. We take note of the physical expansion. The population is big, and physically the buildings cannot accommodate the population that you do serve. Honorable colleagues, let's go straight to query 1.2. That is long-standing payables. What is your submission on that? You have arrears of close to 695 million.
Yeah, thank you.
As you do make a response on that, we realize you only pay 5% of that budget. That was 32 million. As you do take us through your arrears, you'll also update us on how much have you been allocated as an entity for domestic arrears this financial year, 2025-2026.
Okay, yeah, thank you, Honorable Chair. Yes, that's very true, and much of this money actually, it is water bills, which has accumulated over a long period. And the true reason, as much as we've given it a priority, every financial year we give it a priority, we want to clear these areas. But because of the persistent, insufficient money, we find that we cannot clear this debt. And again, to be sincere to you, that hospital is very old. It was constructed in 1952. It came with an old form of plumbing where metallic pipes were being laid in the ground. And over the time, these pipes develop rust, and they become actually, the lumen of those pipes, you find that they become, I don't know how I can explain it, but you find that the pipe which was laid in 1952 is now clogged with the rust. And every attempt we make a repair, you repair here, then there is a breakdown just before that repair. There is also an element of wastage of that water because of the oldest plumbing system we still have in a hospital. We've devised the means. We've tried actually to make sure that, yes, if we can't pay these areas, but at least let us fight and see and make sure it doesn't continue raising. We harvested water from the roofs of the hospital. We attempted to have actually the automatic taps, such that, you know, these patients who are using these taps, sometimes people have seen them for their first time. They don't know how to open and close them. So we attempted that. But because of the size of the population, these water bills continue rising despite our efforts to bring it down. And honorable members, I'm a bit scared. Very soon, we shall actually get a commissioning of a call and dispatch center. It is coming up. And this call dispatch center, it has a hose pipe. All these ambulances are going to be now cleaned and washed from the hospital compound. We have 100-bed capacity neonatal intensive care unit that is coming up. It is a complex. We don't see any increment in the funds we are receiving. We are getting these new structures. I'm very sure the next time we appear here, really, members, this water bill is likely to have risen even from where it is.
Accounting officer, what is your annual budget for water and electricity?
Madam Chair.
Yes, Honorable Angura.
Thank you very much. We really appreciate the explanation of the accounting officer and the good intentions that you have. But Madam Speaker, Madam Chair, this one now is moving towards the lamentation. When you look at your statement of outstanding commitments, you are even going ahead to further commit government before settling the outstanding areas that you have. You can see your new outstanding commitments. Just on utilities was 100 again. So you're telling us that next time we might get it at 500. So these new commitments should not arise if you are to look at the PFMA. I know Honorable Mudim is going to...
Section 20. Madam Chair, Section 20, number 2, accounting officer, much as you are a medical person, but when you take the role of accountability, you have to be familiar with the role. I think we're on the same page, sir.
Yes.
Yeah. So it says, Section 20, budget execution by accounting officer. Number 2, a vote shall not take any credit from any local supply or any body unless it has no unpaid domestic arrears from a date in a previous financial year, and it has capacity to pay for the expenditure from the approved estimate as appropriated by Parliament for that financial year.
Yeah.
So you are not supposed to take any. It's a law. And the word is shall. I don't know how you term it in medical. Shall is mandatory. It's compulsory.
Yeah. Yeah, thank you so much, Honorable Member. Thank you. Thank you, sir.
That was just now the observation from there. I had not yet concluded. Because now we need to look at your appropriation. You take us through your appropriation to show us what you had budgeted for these utilities, to avoid you continuing to accrue more based on the provisions of the PFMA. What did you request? What did you appropriate? Then we shall look at what you received and know that the problem is not with you, but it is with what? With the finance. Let's say, take us through your statement of appropriation.
Yeah. Thank you, Honorable Member. Just if you allow me, take you back on these two projects I'm lamenting on. They are actually Ministry of Health projects. This was a grant from the World Bank, the Neonate Intensive Care Unit, and
Accounting officer, before we go to the new project, you first take us through the appropriation in regard to the facts that they have raised. And you are at liberty to use these of your staff that you moved with. For anything that is technical, refer the question to the technical person to make a response on your behalf.
Yeah.
Please.
Yeah,
Let us first go straight to the issues of utilities and why do we have those outstanding arrears on utilities.
Okay. Through you, Chair, allow me to request our principal hospital administrator and even senior accountant. I know they have these figures at their fingertips. Thank you.
Yeah, thank you, Chair. I think if you have, we can go straight to the financials. Note number 10. This is on page 25. Yes, you'll see the allocated money on utilities is 889, 361, 657. That's what was allocated. But maybe to explain more, if we are to look at non-wage specific, where we draw this budget, it is a budget of 1,050 million. So you can now look through and see the challenge which the hospital, yes, because that's where we draw, that's what was allocated.
Sir, this is specifically for utilities and the property expense.
No, specifically, this is the property expenses, what they mean. Here, you add if we use it like firewood or what, which we do not have in our site.
Yes.
Yes. So it is here specifically, it is water and
power
and electricity. And specific to water, here water took on its share, it's around 500 million. If you added, if we went to our trial balance and see the details of how it was spent out, that's where you would get the details. So the challenge, the allocation here is made.
So what is your allocation? For water?
Water?
Yes.
For this financial year?
No, for that very financial year under review.
560, I can't.
Where do we find that?
If we went to
the trial balance,
to the TB, trial balance.
That is page what?
Page 51.
51.
Code item 223006. You will see water, and we can add specifically those.
So what would be your desired budget for water?
But the 100 million was paid, right?
Yes, all these are payments.
But here we have seen it.
You pay, but again it increases.
But
Yeah, you consume more than...
Accountant, we do observe the 500 million you are talking about. What would be your desired budget for water?
Madam Chair,
Yes.
the 100 paid. Let's still look at the statement of outstanding commitment.
Yes, on page 40.
Yes. The payments that were the commitments paid during the year was 32.
That's what was allocated by Minister of Finance under arrears, settling the
utilities.
No, not necessarily only utilities. Actually, it was, we had goods and other services.
You open first and open your statement of outstanding commitment.
I know it at 32 million.
Yes.
It was broken down into two,
Only.
10 million and 22. 22 for water, and then 10 for other goods and services.
Accounting officer, we want to avoid the entity accruing areas as we do proceed. That's why we are asking, what would be your desired budget for water?
I think around 800 million.
Around 800 million.
Yeah.
Accounting officer, the reason as to why we are a little strict on the issue of utilities is this has been a general problem for all regional referral hospitals, and we cannot proceed like that. So if your desired budget is 800, how much were you allocated underwater for this financial year, 2025-2026?
660.
660. That means we are going to continue having the same problem. We are going to accrue more areas. And he's saying you are about to have new structures. Colleagues, order, please. Salong and your colleague, order. So this means we are going to continue accruing more arrears. You see? How much do you have under electricity for arrears? You don't have arrears in electricity. So your budget is sufficient for electricity. Okay, you own Yaka. So the only challenge you have is water. Honorable colleagues, we do take note of the issue of domestic arrears. It cuts across all entities, but you should avoid accruing more arrears. Aware that you are not supposed or you are not meant to commit the entity beyond the available funds. However, we observe that some of them are unavoidable. So as an entity, you also have to look for alternative ways of, having water. Yes, you've said you are harvesting. That's good. I don't know whether that is the only alternative that you can look at as an hospital.
I think apparently it is that, Honorable. We thought of actually digging, creating like a borehole, but the position where the hospital is positioned, it's like in the center of a city, and we were advised that it is not very, very possible.
Otherwise, you must take note that you might not sustain that huge budget on water. As you do proceed, it's quite a lot. Yes, Honorable.
Chair, circumstance where the accounting officer flouted the law. I've read to you the law, and there are also sanctions on the same. I don't know whether you have ever seen this book. Have you ever seen it? Or they are based in the Kampala?
I think I've seen it, but I could not have read it out. Yes.
There are sanctions, so what can you say about it? Failure to meet the requirement of the law. So on the 76.
Can you read it?
Liability on failure to meet requirements. There are a number of them. A person commits an offense if that person without lawful authority under this act or another act without reasonable excuse fail to provide, they do that. But I'm reading the one I'm interested in. M. In case unauthorized expenditure or makes unauthorized commitment. Because the law is trying to avoid you to make a commitment, but you went as far as making a commitment, so what should we do?
Yeah, thank you, Honorable Member.
There are also such charges on the same.
Maybe you will guide me. I just request that you guide me.
Accounting officer, just take note that
Yes,
you are not meant to spend outside the budget. That is it.
Yeah.
You cannot make a commitment without ensuring that there is availability of funding.
Yeah.
You have seen some entities accrue interest on some of these transactions that you do make.
Yeah.
We can give you an example of Ministry of Works here. Because of these domestic arrears, we are paying huge interest on some of these. So that's why the law avoids, you working outside what is provided for.
Thank you.
So, honorable colleagues, let's take note. At least the beauty is these are issues of utilities, but you also have to know that that is outside the law, whether utility, even if you had bought a bed that is outside the budget and you commit an entity without confirming availability of funding, that would be,
Yeah.
you commit an offense. So, honorable colleagues, let's take note of that.
And Madam Chair,
Yes.
that is why there are provisions for supplementary.
True.
Yeah.
And in this case, you know the three requirements that guide us towards the supplementary: unforeseen, unavoidable, and so on. So you're requested to budget because this one was foreseen. But if you can convince the PSST beyond reasonable doubt, then you can be provided a supplementary, other than blatantly committing.
Yeah, thank you so much, Honorable.
Honorable colleagues who have just joined us, kindly introduce yourselves.
Thank you, Chair. Good morning, everyone. My name is Susan Amero, the Woman Member of Parliament, Hamuria District, and a member of this committee.
Thank you, Chair. I'm called Isaac Modoi. I represent the people of Lutseshe and I'm a member of this committee. Thank you.
Thank you, Chair. My name is Sarah Pendi, Tororo District, and a member of this committee.
I thought you also had Mukuju. But, Honorable, what happened to Mukuju and Namulanda? You know, you are Honorable Angura, I hate that light story. But the team from Bara, you take note that we are supposed to have a new baby on board. That's why we speak of Mukuju and Namulanda, but the process is in progress. Our honorable colleagues, let's go to 2.1, review of implementation of the approved budget. For these ones, we are just going to take note that as Zimbabwe Regional Referral Hospital, you had a budget of 18,812,643,888, and you got 17,325,977,170 was warranted. You take note of that. That means you received, why did they say that you received 100% of your budget? No, it's 80. And the auditor audited 17. The total warrants, that's 100%. Eh? So we take note of that, and we shall go straight to utilization of the warrants that you did receive. Though we take note of these budgeted activities for which no funds were released. These were G2G funds, and we shall go through them as we handle the issue of G2G funding as a project. So we are going to go straight to 2.12, utilization of warrants and implementation of planned activities. Out of the 17.17,325, 16,630 was utilized. You failed to utilize 695 million, and these were funds meant for salaries and pension. Accounting officer, why didn't you pay for salaries and pension? What happened?
Okay. Yes, thank you again. As you are aware, before 2024, there had been a ban for the recruitment, and that is the money that had accumulated for that period. We were so lucky that we received the letter lifting the ban in February 2024, and immediately we started the process of recruitment. So by the time the audit was done, the recruitment was still in the process. I'm lucky to inform you that eventually we managed actually to recruit 18 essential cadres. We have them on a list, and progressively we have promoted 32 staff members.
What about the pension?
Yes, through you, Chair, allow me request our Principal Human Resource Officer to shed a light on this.
Honorable colleagues, I think we can handle that concurrently with staffing, the staffing levels in the hospital. That is 3.112. It basically speaks about your staffing levels. So as we handle the issue of failure to utilize the 463 million for recruitment of staff, we also handle it with staffing in the hospital. So HR, you speak to the two. We take note that you are staffed at 23% and you lack critical staff, as mentioned by the auditor under that bulletin. So speak to the staffing and the critical positions that we do miss. Currently, after recruitment of the 80 and so, Have this improved your staffing levels? Are you now comfortable with the staff that you have? Give us an update.
Thank you, Chair and members. About the pension, we still had a challenge of pensioners failing to get the proper documentation, and yet we cannot proceed without them delivering. So we took an initiative and sent one of our staff to look out for them. He managed to get some of them, and they were eventually paid, but failed to get others because they stay quite far outside Mbarara.
Before you proceed, honorable colleagues, how I wish we can get a list of those who got lost. You know, pension is a statutory obligation. And I wonder how somebody who had the details of their contact with you, I wonder how that person can totally get lost. So accounting officer, as she makes her response, we need to get details of those pensioners that have got lost. Yes, Honorable Sarah.
Thank you very much, Chair. Chair, I am surprised hearing such a response, because normally when people retire, they actually follow up their money and they want to be paid. So when you say that they got lost, I am just surprised. If I retired now from this parliament, I would be in the pension office the next day. And also, secondly, I expect you and the Ministry of Public Service to have pensioners' records. Chair, it surprises me that somebody can serve this country for maybe 30 years plus, depending on when they join the public service. And then on exit, then documents are missing. Why should we have this kind of scenario? It may not be their question, but I think there is a problem, generally. Because when I was contributing to NSSF, apart from now the release letter showing that I had retired from my former job and had entered another pension scheme in Parliament, I took nothing. NSSF didn't ask me to produce this document, produce the other. No. They have my records. All I need to do is present to them, because I was demanding for my money to be given to me so that I could invest it elsewhere. So all they needed was a letter from me requesting for that I am retiring from the NSSF and I have entered another pension scheme, and therefore I needed to be paid my money. So this business of people have retired, these documents are missing. I think we must get to the bottom of this. It means there is some, I don't know, some laxity, a serious problem within public service, but also within your institution, because you are supposed to have records of all the stuff. And before you release me, why don't you check my documents and say this document of yours is missing?
Accounting officer. Yes, Honorable.
Supplement.
Thank you.
I think the public
Thank
service
you,
cleared
Chair.
public service cleared that matter. I think there's some problem with the university. They said you notify the hospital that you notify them that you are going for retirement, and they sure all your documents are intact, as she has stated. By the time you are notified of your retirement, everything is complete. In fact, what remains is for you to get process of final pay and eventually your pension. So that story doesn't carry. And the public service was very clear to that effect, and even said, if it so happens, the accounting officer to be held personally liable. So there is no way you're going to tell me that I have retired, therefore I have gone with my document. Mind you, the documentation of a person is a person. It's a file moving. To reach a level that you are retirement, you notify me when you have calculated everything, I've just retired. So I'm telling you from practical experience. So to say that you are looking for, instead of looking for my money, is not only a lacuna, but I think something to be investigated. There is no excuse.
Yes, Honorable Mero.
Thank you, Chair. Chair, I just want to add my voice to my colleagues. It is perturbing to hear such a response being presented before this honorable committee. Chair, I get so disturbed with some people who don't consider the people they are supervising, others, the people they are working with. How can a whole human resource who knows about everyone working, you are very keen to know that they are on duty, but when they are going to leave, you don't want to know how they are living? Are you okay? No, are you okay? And you present such a response here? Honestly, these people work. These people join the public service. You have their files. Before they retire, you notify them. How do you come with the date of retirement when you cannot find out whether they have all the documentation? How are you keeping them in service without their documents? And then they disappear? Where have they gone? I hope they are not ghosts. Where have they gone?
Accounting officer, members are very passionate about this because you know
This is
what old age means. Eh?
Yeah.
And once one exits service, that is something one would be looking out for. You also consider it. You've left active service, you are out there, you badly need this little money to help you throughout your old age. Now just imagine you come here, you tell us somebody got lost. That's why I was interested. That's why so don't think that members are taking it personal. But you know, as representatives of the people, we do interface with culprits of this, people who have, who have gone through this. They've suffered. Actually, they are casualties, not culprits. They are casualties. So when you see us being passionate as representatives of the people, we really have a feel for it. But you also, for yourself, you at some point you'll be, on the other side. That's why we always encourage you, human resource, make sure that these issues of pensioners are handled. Why do you make a friend move up and down to the extent of saying that somebody got lost? Now, as we do proceed with the response, Madam HR, you will not leave this place before you give us a list of those who have got lost. And actually, I will help you as we are seated here. That list will be displayed. You will find themselves come to your office. They will come by tomorrow. So you are going to provide a list of all those pensioners that you have failed to trace.
Chair, maybe that was then. Maybe that was...
No, you, team from this side, just know you came here to be heard. So leave the honorable members to submit. Not, you'll be given all the ample time to make your responses, please. Yes,
Chair,
Honorable Sarah.
Chair, I just wanted to, maybe, of course, this was an audit report, which is a year ago. Maybe they should tell us the status currently, whether they are still, these people are still lost, and you have not been able to trace it.
A response? No, accounting officer, do you have something to say before she comes in, or she handles to it?
No, I know she will answer, but honorable members, Honorable Sarah and your colleagues, as we display this list, you'll find that actually the discrepancy, it is because of the letters of administration. Some people, for me already, I know 2 members who died in my presence there. They were married to 2 wives, each of them, and they have disagreed.
Accounting officer, let's not go into that story.
Thank you.
That's why we asked for those who have got lost and their details, such that we can see how to help you.
Yeah, thank you.
Because issues of letters of administration, we know you get challenges, but we want to see how you can be helped.
Yeah.
Yes, HR.
Thank you, honorable members. The information that I gave was when we were still using the IPPS system. Right now we are using HCM, which is integrated. As I speak now, someone that retired on 10th of July is going to be paid. So the information I'm giving is for some time back. Then some of them resurfaced, and they were paid end of July. Yes.
So we need to get an update of those that have not been paid. No, she started well. Honorable Amero, it's good for somebody to be factual.
Yes,
no, leave it at that. Leave it at that. If you try to rebuttal, you'll make matters worse. You have made your submission. You've been heard. So what you should do, accounting officer, we need to have a list. Honorable colleagues, don't you worry. We are going to have this sorted. We need to have a list of those of our colleagues that are still pending, please. Take note, accounting officer. Yes, but the beauty is, as you are seated here, we have a team that you left behind. As we do handle other issues, HR might not be so relevant on these other issues. So my sister, communicate home to have some of these facts submitted. I know there are not too many.
Yeah.
So we want that list before you leave, so that we can help our colleagues get their money. So, colleagues, we are done with the issue of pension. Then when it comes to the staff, we are still handling the issue of staffing levels. I told you, as we handle this, let's handle it concurrently with the last item 3.12, staffing in the hospital. Accounting officer, the auditor notes that I reviewed the approved structure and noted that out of the approved structure of 1,269, you only have 301 staff. That is 23.7%. Those positions that are filled, leaving a gap of 968 positions, and that is 76% are vacant. And some of the key positions were highlighted. The key positions that are not filled: senior consultant medicine, consultant anesthesia, consultant orthopedic, consultant pathology, consultant surgeon, that MOSG, you will know those details, but we have critical positions that are not filled. So update us about your staffing levels to date. HR on microphone, switch it on.
Thank you. As far as the staffing is concerned, apparently we have 300.
A moment, honorable members, as you go to Appendix 8, as she takes us through, go to Appendix 8. Yes, you can proceed.
As far as this is concerned, we have made submissions for senior consultant internal medicine. We have recruited MOSG psychiatry, and then we made a submission for MOSG pathology. Then just below there, the consultant, senior consultant pediatrics is also in place right now. Then these others, we are yet to advertise. The submission for advertising has been made already. So it is up to Health Service Commission to run the advert.
What is your staffing levels to date?
My staffing levels is at 30%.
How did you get to 30?
29, sorry.
No, you need to be factual. How have you shifted from 23.7 all of a sudden and you are at 30%, madam? HR?
Chair, maybe to add on that, I wanted to ask, I had the accounting officer say they did some recruitments, but they also did internal promotions. So I want to believe that the recruitment was meant to bring in new people, and wanted to know how many came, and then we also want to differentiate from those who have just been promoted internally, because when you promote internally, it doesn't change the percentage. So we want to know how you are standing in that regard.
Yeah, thank you, Honorable. We recruited 18 new cadres, and we promoted 32. Originally, we were at a staffing level of 23, and 18 brought us from 23 to 25, I think, 0.3. And again, by the time this audit was done, actually this 1,400 and something workers, it is a new structure. It had just come in. Originally, actually, we were almost 100%, Honorable Chair. With 301, we were almost 100%. So a new structure comes up with 1,400. And that is when the auditing was coming. And we never had any more money. We are only lucky that this financial year, we've been given 2 billion to recruit. So we want to use this chance and fill some critical areas where we have glaring gaps. Thank you.
Accounting officer, for how long has this new structure been in place?
I think it has been there for the last 2 years, 2 financial years. And the promise has been that progressively would fill the gaps. The only chance we've managed to get money is this new financial year.
Chair, something very small.
Yeah.
Do you have organization, they call it organogram?
Yeah.
And you have an establishment plan? Personnel establishment plan?
Oh, yes, Honorable.
You have it?
Yes, we have it.
And do you have a copy with us? Or?
No, not we.
I'm asking this question because you're a teaching university. Am I right?
We are regional. We are
regional.
A regional referral hospital.
But also that's also the teaching.
Yes, sir.
So there is also benefits of the footloose benefits of within the staff that you teach.
Very, very true. That's how we've managed.
So they fill in. That's why you're very special.
Yes.
So when they fill in the gap, you don't feel the pinch like others. Are we together?
I get you.
Because
yes.
Are we there?
Yes, please.
So now I know where you're heading. I withdraw. I was there with you, so I know what I'm talking about.
Yes. Yeah. Yes.
So, honorable colleagues, the reason as to why government provided a new structure, for me, I think probably is because the old structure could not serve the requirements. Yeah. You know, the current requirements. That is why we have a new structure. So you should not appear as if it's a fashion.
Yeah, and Chair, why I'm bringing this, maybe we're having issues because Ministry of Public Service is reviewing the establishment. So I'm wondering whether you're also part of the review or you are using the old system of establishment. Because in so doing, it will affect their budgeting. But that's for another day.
Definitely, as we do proceed, honorable colleagues, he says the new structure has been there for the last 2 financial years. And for government to bring out a new structure, they ought to have done all the preliminaries. And that means the moment it's out, they are ready for recruitment. Now, when you look at the table, Appendix 8, under internal medicine, according to the structure, you are supposed to have 186 staff under the approved structure. Actuals, you have 56. You have vacant positions of 130. You see? So how, for me, I have a feeling that as Mbara Regional Referral Hospital, our patients are underserved. The population is very underserved. Because how internal medicine, who is under internal medicine? Because I believe these are medical staff.
Yeah. Yes.
When you go to pediatrics and child health, you are supposed to have 91. You have 5. Colleagues, go to that table. Instead of 95, you have 5. 86. Go to the table if you have this, page 31 of the Auditor General's report.
Maybe, Chair.
This.
Chair.
Yes.
Thank you very much, Chair. Chair, I really appreciate the government intention to revise the structure. And it is unfortunate that from the time you received the revised structure, you've taken about 2 financial years without receiving any funding. Is that what we are? Yes. Now, for the 2 billion that has been provided now, what gaps are you going to fill? Give us also that highlight. Then number 2, you've also told us that you are guided that you will progressively fill these positions with the time. How many years have you been given in order to achieve this? Because this is going to continue being a query here, in and out. And do you have any supporting document, any communication in relation to that? Such that we don't blame you, but we know that public service, together with the finance, are going to help you fill these gaps in the next 5 years, progressively. So do you have any supporting communication to that effect? And how many gaps are you going to fill with the 2 billion? And how much time do you expect to complete the full structure?
Honorable colleagues, when you look at Mbara Regional Referral Hospital compared to others that we've been interfacing with, yes, they also have challenges of staffing. But we need to also find out from this other side of ours, what would be on the new structure, what would be the sufficient percentage, just in case we are to give, sufficient services to our people. Because for now, if you look at surgery, you want 67 staff, you only have 7. 60 are missing. Honorable, it's not about this being a query for time and again. We are dealing with lives. We are dealing with lives. And remember, we have just started the financial year. As the Public Accounts Committee, we can move government to ensure that these regional referral hospitals are given sufficient funding and a wage. Because, you know, if you cannot offer your basic mandate, because your basic mandate is to treat the people. So if you don't have the staff to handle this assignment, then what are you there for? You want 67 surgery staff. You only have 7. 60 positions not filled. So I think from the key areas that we have highlighted as challenges, the issue of staffing in all hospitals must be handled immediately. The things of waiting for the Treasury memoranda, honorable colleagues, shall not suffice. Because what is happening to the people who are going to access these services? And he has told you the population has increased, much as the structures are not expanding. He's very congested. So he's congested equally, but also the staff this side are very constrained. Yeah. They are overworked. You know what medical is? This is why you will find people being operated and they are left over. We hear they live over, what do they live? Caesar, whatever. Cotton within the, you know. So we must also sympathize with this team, this other side. So, honorable colleagues, as we interface with this issue of wage and staffing, it must be under those that we are to look at as we interface with the other big team of finance, health, and even the speaker said she should be part of that team to ensure that the areas that we must negotiate with immediate effect, our colleagues come up with supplementaries. Otherwise, health is a basic, you know, is a basic necessity. We cannot compromise on that. Yes, Honorable Isaac.
I want to agree with you because in one meeting, I think they are victims, not victims. They are willing to serve. I'm saying this without fear of contradiction. You remember at one time we agreed that there's need for us to interface with 4 ministries: Public Service, Ministry of Health, Ministry of Finance, because these are policy issues. Now they are at the tail end, struggling. So, and for them, because the situation is that they implement what's there. They want to implement, but they are somehow stifled. So I want to agree with you that since the Speaker even agreed to be part, because this is a national matter that should be addressed across the board. The civil servants are just merely, what can I say? They are seeing small things as there. So how I wish that should be a timeline. How I wish that you use your good office to have timeline to engage with these big ministries. Because these ones are just implementing what's in the policy. Let's have the timeline. It's not the first time, by the way, we're discussing it. When should we do it?
Honorable colleagues, we are going to have this engagement next week because we wanted to finish all the referral hospitals so that we can know those that are too ill. I don't know whether you will also be in the ICU, but there are some of your colleagues that are in the ICU. You were hospital, but you are supposed to be also, you know, admitted. So we shall, yes. A hospital is in a hospital. A referral has been referred to a national referral hospital. So, for further management, Honorable Sarah.
Thank you very much, Chair. Chair, I know the challenges that this sector faces, but I wanted to find out from the Chief Executive, the accounting officer. I know you utilize the university staff. So I want to find out from you, for example, if we are talking about maybe it's the psychiatry, you are supposed to have 71, you only have 12. So I want to find out from you, in utilizing the university staff, what does that bring you to? They are not your staff, but in just numbers, I want to understand. If you're supposed to have, for example, surgery, 67, and you have 7, from the university, how many come in to fill the gap? I just want to understand so that it leads me to my next question. Otherwise, Chair, for me, I think Ugandans are dying prematurely, partially because of lack of manpower, lack of staff. Because somebody comes to a hospital, you have, for example, where you have no ENTs, ENT is 0. Nobody. Out of 21, none. So assuming somebody had a complication, or even orthopedics, you have only, out of 45, only 7. Now, assuming these orthopedic officers are engaged, the 7, maybe 1 is busy in theater, or 2. The others may be away for, we are human beings. So what happens? So Ugandans are dying prematurely, partially because of lack of the relevant staff available to do the proper diagnosis and provide it.
And moreover, Honorable,
so can I understand in terms of the university staff?
And moreover, all this manpower is on the streets. They are trained. They are all over the country. They are unemployed. So I think it is us. By the way, we are shifting the blame. It is us, the parliament. I think it's like a father crying and children crying. I think it's the parliament where I sit that must come out clearly, because we have this trained manpower on the streets. Can't we come up with a policy? Maybe we resist, because no. What I'm saying, medical doctors.
You want the members of parliament to go and work in hospitals.
There, where you go. You have just survived. You be careful. What I am trying to say, colleagues, is that I'm addressing the issue beyond. I'm addressing beyond this.
Honorable, proceed.
That every year, people are graduating, and the ceiling is there, and yet we have manpower which graduates every year in these relevant sectors. So it is us, Parliament, I believe, that should come out with a policy that we should...
Let him first finish. Okay, please.
I want to thank you for the opportunity. Wouldn't it be procedure right that we discuss some of these issues in-house as a senior legislator?
Honorable colleagues, can we listen to each other? There are matters that are not, they are not too secret. These are public issues, and they are being addressed in the right place. We are talking about staffing, and the country must know that we are understaffed. It's a policy issue. We must speak to the authority. That is why, Honorable, let me give you a ruling. That is why we said we are going to have an engagement with the key sector, with the key stakeholders. That is the Minister of Health, the Minister, and the PS. Finance, the Minister, PSST, and also the heads of these institutions that were critical. And also when we discussed this with the head of the institution, she said she should also be part, the speaker should also be part of this. So what you are talking about is going to be addressed. Honorable colleagues, some of these issues are not going to wait for the Treasury memoranda. People are not going to die when we are in that house mentioning procedure or order, and you know. So he's speaking to the right forum, and we are going to have these matters handled. Though I also take cognizance of your observation that some of these can be handled internally, but whatever can come out, there is no secret in this that we are mentioning. Honorable Susan Mugabe.
Thank you very much, Chair. Chair, when you look at page 32, still, about the staffing gaps, Chair, there is a critical care unit. To my understanding, I think this is a point where maybe you say someone is about to die.
Is this the ICU?
They are supposed to have 53, and they don't have any staff there.
You said they have 0.
They have 0 staff there. Critical care, where even you as the attendant to the patient, you're also almost losing your life because of pressure. And then you see someone is supposed to be in the ICU, there is no one to attending to the patient. Then, Chair, we've been looking at the staffing of the different entities or hospitals, and I've been always seeing the gynecology department. But I'm not seeing it here because, you know, for us women, we're a bit special. We are having, in most cases, we have our doctors as gynecologists.
I'm seeing obstetrics and gynecology. They have, the requirement is 141, they have 47, missing 94.
Okay.
It is stated. All right. So as we do proceed, our clerk, you are going to call for all the staffing details for all the referral hospitals, national, specialized. All of them should give us details of their staff and the positions that they do occupy. So that because this has been brought out very well, for some entities it came out, for some it did not. So this will help us to know where to start from, especially on the key positions that are supposed to be filled. Number two, we need to know that much as this structure is new, what would be the appropriate percentage to be filled so that we can at least, we can to averagely serve the people of this country. So, yes, Honorable Nekesa.
Thank you, Chair. I'm Nekesa Victoria. I represent the UPDF. Welcome. So I can be late. Chair, Honorable Saro Pendi raised a pertinent issue to the CEO about the university staff and the ones that we have for the ministry. So I would like to add on that you answer, accounting officer, the collaborations. I know we've had teaching hospitals, that means there's university teaching staff that are also medical and other therein, as well as the Ministry of Health, which are intertwined, you know. Inextricably, they're really intertwined so much that you cannot tell the difference. There's no drawing line there. So can you tell us how these collaborations work and whether the work given in by the teaching staff does a bit of the cover-up that makes you go a little mile longer, or you are so discreet that you don't have anything while in the same house there? And we need to know how this works for us to make the services better that can answer some of the questions that have been raised here. Thank you.
Honorable, lastly?
Yes, lastly, I just wanted to find out. The Chief Executive Officer is supposed to have some staff in his office. Yes. Out of the 10, it is you alone. So I want to know how he's operating. As the chief executive, you are one person who is the secretary, who is the receptionist, who is everybody. What are these positions that you feel you can do away with and you are an all-round person handling all the other 9 tasks, inclusive of yours?
Accounting officers, you also note the nursing division, you are supposed to have 2, you have 0. You can respond.
Yeah, thank you. Thank you so much. Yeah, thank you, Honorable Saras, for the concern. Yes, I want to tell you that the Mbarara Regional Referral Hospital actually is thriving on the back of Mbarara University of Science and Technology. Actually, when you go in the details here, there are a lot of activities we are running in the hospital, but they were never captured because they thought as a regional referral hospital, we are not meant to do them, but we are serving. We have like dermatology. We have isolation units and very many others. Yes, what is our collaboration? We are very lucky. As I told you the story, because Mbarara University of Mbarara Regional Referral Hospital at one time was a purely teaching hospital. Actually, it was called the MUTH, Mbarara University Teaching Hospital. There is that cultural bond. But we've gone beyond the cultural bond. We have memorandum of understandings. And there are a lot of nitty-gritties in the memorandum of understanding. But the special thing is that if I'm employed by Ministry of Health as a senior consultant surgeon, when I reach there, I take up the teaching.
Yes, you can proceed,
yes.
Officer.
Thank you, Honorable Chair. Yes, I automatically take up the teaching responsibilities. I find myself designing a curriculum with the people of the university. I find myself lecturing, examining, and even attending the council meetings. It is the same story. The lecturers from Mbarara University of Science and Technology, when they are here in their teaching hospital, they do that clinical work. It is a must. And that is how we are thriving, honorable members. As you've seen at this small skeleton we have, we still continue to serve. A unit like radiology, the ministry doesn't have any person, but we have the heads of departments, and he has the people below him. Comes from the university. If you go to intensive care unit, it is the same story. You go dermatology, same story, and ENT, and very many other aspects. So the truth is, the university is growing faster than the hospital. They are introducing new units, new services. They are employing lecturers, and we keep on absorbing. We don't bounce them, because our sole primary target is that we care for these people. And for example, you can see that now, actually most of the neurosurgical operations from the western region no longer cross that place. You only come to Kampala at your own will, if you're just coming because you want to be treated from Kampala. Otherwise, we have all it takes to cater for neurosurgery, for urology, for cardiothoracic. Yet, the Ministry of Health doesn't have a specialist there. It only has some few nurses. That's the beauty we've been enjoying actually we've leveraged on the presence of MAST. Thank you. Okay. About the staffing.
Honorable Sarah, you are off record. Can you?
Yes. Can we say then that in terms of they are not your staff, but in terms of providing services, you are at 50% or 40%?
You to give me a chance, Honorable, maybe to make some needs analysis to confirm. But at the same time, I want to remind you that MAST is also enjoying our presence. Because when we get employed, we cross and serve. Thank you.
Chair, for that matter, just a little more. So for that matter, CEO, that's you mean to say that you're not in ICU. The rhetoric that you're in ICU as a referral hospital is not really binding here, is it? That you're in ICU because you don't have the manpower and the services going to people because you have fewer staff, yet you have the partnerships and the collaboration that are making you work. So are you in ICU as been said here, or you're not? Can you make that clear to us, sir?
Thank you, Honorable. I think we are in the high dependency unit. We haven't reached the ICU. And the little cushion we have is from MAST. Yes, thank you. Almost. Thank you.
He doesn't qualify to be an outpatient. He can. They will take the tea after work. No, they slept in Kampala and they took tea. They still have a lot to handle here, so they will take the tea after this engagement. Honorable colleagues, we are going to go to B. That is implementation of funded activities, and that takes us directly to Appendix 3. Appendix 3 indicates the activities that were partially implemented. Partial implementation of activities denies clients access to the intended referral services. So when you go to Appendix 3, Accounting Officer, Appendix 3 shows the details of the quality of the services that you render to the people, because this is the actual implementation of your work plan. For example, you planned, honorable colleagues, go to Appendix 3, you planned to carry out 2,488 family planning contacts, and you only handled 1,829. You had a variance of 659. For there, you somehow tried, but also I want to take you to item 3 of 3,340 clients in the elimination of mother-to-child transmission program handled. You also did well here. You only had a variance of 29. Let's go through this list. Go to a moment. We proceed to outpatient services. You planned to carry out 21,112. You only carried out 18,000. You have a variance of 2,000. For here, you did not do well. But remember, the reason as to why the auditor faults you for this is you received all the money for the activities that you had planned for. And you partially, partially implemented. In the actual sense, if you had planned to carry out these activities and you allocated all the funds, you ought to have carried out all these activities. But we see you spending all the money, but you partially handle the activities that you planned to do. So where did you put the money? Under circumstances where you handled a few activities less than what you had planned. But also pick interest in the next item of you planned to have 125,840 patients anticipated to be handled in specialized clinics. You only handled 67,713. This is close to half. So you need to explain why this partial performance. And on HIV, by the way, on HIV, you planned 20. You did not do any HIV. This is number of CSOs and service providers trained. You did not train any. What happened to those services, yet you received all the funding? Accounting officer, back to you.
Yeah, thank you, Chair and members. Yes, we note your good observation, but the truth is, by the time this auditing took place, there was a new system of capturing the hospital data. It is called e-AFIA. E-AFIA. And e-AFIA, the people who were making actually the local area connection, they were partners. The partner we had by then was called the UHA, Uganda Health Activity. It had been given various hospitals. The first time they came to Mbarara Regional Referral Hospital, I don't know whether some members are aware of the geography of our hospital. It is scattered. It looks like a village. We have some departments above the road that goes to Kabare. We have departments in the center of the university. We have other departments that are bordering that meandering river. So the partner felt that can start with other simple units. And that is how they came to Kirudu, because it is easy, the construction is fine, and Kawempe and other places. So we were the last people to be given the local area network. And the auditor was actually considering the information captured by e-AFIA. In that circumstances, we ended up actually missing some obvious records. I'm so sorry for that, but so that's the scenario, that's what happened.
Accounting officer.
Yes.
If the e-AFIA could not give the accounting officer the information sufficient to have a true picture of what happens in Mbarara Regional Referral Hospital, you mean you could not give other sources of information to convince the auditor that you know what you have captured is for e-AFIA, and physically this is what happens? Because remember, you are transiting from one system to another. And this audit is there to give us a true picture of what took place in regard. Actually, this is where the implementation of your budget is. This is the real section for accountability. Now we are saying you planned to carry out so many activities, you received the money, you did not carry them out. I want you to read the response that you gave in your book. The response according to whether the e-AFIA is part of the response that you gave as you are responding to this. Number 2, you received the management letter, and you noted that the e-AFIA lied to the auditors. What did you do to bring out the true picture of the performance of the entity? Yes, Honorable
Isaac. And the Chair, to add, the fact that we appreciate whatever you call the e-AFIA, whatever. But what's the update? Because in any case, to carry forward the question, it means that you were given ample time, you did not resolve it. If you had resolved it, it wouldn't have come up this level. Are we together?
Yes.
That's how I know it. So in other words, up to now you never resolved it. That's why the question was carried forward. Am I right? So what's the update now?
Yeah, thank you, Honorable Member. The update is that the whole hospital now is actually connected, and we are getting that information from all the departments.
We will update with the auditor, not with us.
Okay. Thank you.
Accounting officer, we take note that the system might be, connected throughout the hospital, and you can now accurately enter the data. Our interest is to verify whether it is true that the EAFIA misled the auditors. And I want to find out from you, if the EAFIA misled the auditors, why didn't you provide the sufficient information during the time of making your responses to the management letter? Honorable Susan.
Thank you very much, Chair. Chair, the confidence that the accounting officer is exhibiting, for once, I'm like, I think Jesus is walking on the ground. Chair, even if the project started from one section of the hospital, which is scattered, the auditor was there to do his work. It was incumbent upon the accounting officer to take him where he thinks the project has started from and report what is on ground. Why did he keep off this information and now he's bringing it here and explaining like he's God sitting on the throne?
Accounting officer, were you given time during the exit meeting to have these explanations given, and the auditor did not listen to you?
Thank you so much. I think through you, Chair, I can allow other members, probably, maybe my English is not that nice. Yes. Yeah, thank you.
No, I think that's clear that we appreciate your communication skills and the confidence. What we are saying, like the chair has posed the question, what did you do to rectify, to provide the relevant information? Because the fact that the auditor carried forward, it means that today it is still pending. So unless you bring documentary evidence to prove that in spite of that scattered and innovation that you made, the issue is now resolved and is here attached. Call it a day.
Yes, that one actually, yes,
Where
I can easily, if you give me time, Honorable.
Present to the chair.
If you give me time,
Chair,
you don't have it.
Chair, he has the queries from the Auditor General, and he's coming to answer those queries. And he had the information, but he chose to leave the information behind so that he comes to tell us a story. I am sure I'm a historian, but sometimes you have to quote. You have to quote. So if you knew you were coming here to answer this query, and you knew that you had information relevant to it, why didn't you bring it to back it up?
But Chair,
what are you quoting now that you are excited? Oh, Chair, I will bring it. Why didn't you bring it? You want to go and collect it around?
Yes, Honorable Negesa.
Chair, maybe the accounting officer has asked to have one of his members. Is it possible okay that they can, in case he doesn't have and the other people have it, and they say something more beyond just him?
Honorable Sarah.
Chair, I just wanted to find out from the accounting officer. I'm very sure that the auditors, before they finally release this report, there's normally an exit meeting. So do you bring it to the attention that the EAFIA information was partial, and did you provide them with all the information? I just want to find out.
Yeah, thank you, Honorable Member. Through your chair, still allow me.
Very okay,
yes,
very okay.
Please. I think Dr. Manzi, you could have been there that day. You can also shed a light on this. Thank you.
Thank you, Chair. Now, during a time of audit, as you know, the agenda, if you had to see most of us regional referrals, there's been efforts towards digitalizing most of the data that we are having, which has been a priority. And I think most of the data that we have been running has been manual data. So, in bid to ensure that we digitalize everything, efforts were focused on looking at the electronic data. So that's why even if we provide the manual data, the interest was all data should be digital.
Doctor, do you want to convince this committee that the Auditor General refused to look at the manual and only focused on the digital? The reason as to why I'm asking that is because, you know, audit is not, you don't think that this is because this is just paperwork. They are giving a true picture of the type of service in terms of quality, quantity that you do give to the people. And I've told you this is the gist of the audit. This is how you spent the money. This is the gist of the audit. So how can, I don't know, how can the auditor be, can I classify it? Not rigid, but insensitive. To give a false picture of what actually happens in Mbarara in regard to offer of services to the people. Because this, at the end of the day, gives a false picture of what practically takes place in regard to provision of services. If somebody says you planned to do these so many activities, for example, you planned to carry out 4,344 X-rays, and you did not carry out, what does that show? Where is the challenge? So this is the true gist of the audit.
Yeah.
In regard to the quality and quantity of the services that you offer to the 11 districts and 1 city of Mbarara region. Yes, Honorable.
Thank you very much, Chair. Chair, I think for the benefit that members, especially Honorable Susan, was trying to allude to, where you did not harmonize with the auditor then, including but not limited to an exit meeting. When you come here, this is an evidence-based committee. You can at least try and look a little neat by coming to now put documents here, say what we did not accomplish yesterday. As far as we are concerned now, here we are. This is the document. Being an evidence-based committee, we can also maybe look at that and see what could have happened. Because we are interested in seeing that what your issues that you're raising are unqualified. Because that means your issues to us, the lay people, are qualified. But to us here, we say they are unqualified. We are interested in looking at that. How unqualified are you? That is the correct status of what your position is today.
But Chair, just a little addition to the concern, Mr. Accounting Officer and the team. Now, you talked about the AFIA, the electronic or the program. Were you behind schedule that the accounting, the Auditor General's team had come and found you're behind schedule for your own failures? Or what happened? What's the relation between that digitization, the electronic media, and this, and the auditor concerned? Did they say that they didn't want to because you're behind schedule by your own faults, or what happened? Or it was circumstantial that you didn't have all your data electronic by this time?
Account officers, you make a response. I want you to pick interest in this item of 4,000. It is the last item of Appendix 3. 4,848 blood transfusions. The actual is 9,844. I mean 82. What brought that big difference? Yes, you overperformed, but what happened? What were the circumstances that made you receive close to half of what you had anticipated? The other item is 300 dialysis sessions anticipated. 300 dialysis. You ended up carrying out 1,269 dialysis sessions. You had a variance up of 900. Actually, you doubled the plan. Then when it also comes to these 344 endoscopy, you only had 180. These we might say, yes, you said we have issues with the data and we are yet to verify, but I want you to speak to these where you overperformed. Are these factual or there is a challenge with data entry? Do you agree to this?
Yes, Honorable Chair, I do agree with these facts. Yes.
Why did you underestimate to this extent? Because how can you plan for 300 dialysis and then you have 1,269? You plan for 300, you have 1,000. What happened?
Yeah, thank you. Thank you so much. Mbarara Regional Referral Hospital actually is the only hospital that does dialysis in that unit, in that area. And we do it on behalf of Kirudu. The hospital doesn't receive consumables or any supply related to the dialysis. So depending on the demand we usually get, we make a requisition from Kirudu Hospital. They supply us, and we do the service. So occasionally, around these festival days, like Easter, Christmas, people who have been in Kampala and have been going to Mulago, have been going to Kirudu, when they reach there and hear that the service has been extended there, they are willing to come because there has been less congestion.
I want to inquire from you.
Yes.
What informs your planning? By the time of planning, didn't you know that you receive referrals from Kirudu? Christmas time, people come, because we believe at the time of you planning to have 300, you put all factors. Because, you know, it is a big variance. From 300 to 1,269, it's a big variance.
Yeah.
For me, I thought that during the time of planning, you consider all necessary factors. At least we can allow a variance that is, you know, acceptable. But times 3 of what you had planned and a half seem to be somehow abnormal. Could be there were challenges in planning. What was too new that you didn't anticipate, you know, that underscored this of your estimate in terms of planning?
Okay. Yeah, thank you, really. The truth is the planning is guided by the previous data we usually have. But again, along the course, we got donations of new dialysis machines. We got actually extra 3 dialysis machines from Bank of Uganda. And when they came, we were excited. We informed the Kirudu. We said we can now actually relieve you. We've got extra dialysis machines. We wanted to put them into use. And that's how we managed now to scale up from a small number to where we are today.
Okay, honorable colleagues, I think that is sufficient, enough to really explain. At least receiving new dialysis machines can explain why you had that big shoot. Yes, Honorable Amero.
Thank you very much, Chair. They received the dialysis machines from Bank of Uganda, and for consumables, they still had to run to Kirudu.
Yeah.
What stops them from now informing the ministry so they can have the consumables given to them directly as a referral hospital than going to pick from Kirudu their consumables for which they have budgeted for the people they have, and now you are having also a larger population from this side. What is your plan in regard to that?
Yeah.
Chair, before you come in, Chair,
yes.
Let me add on something to that. Accounting officer, in your early submission about the dialysis, you said you help Chirudu. Is Chirudu the center for dialysis by policy, or what is there between dialysis Chirudu and then you coming into offer? Can you get more light to that effect? Thank you.
Yeah. Yeah, thank you so much. Thank you so much, Honorable. Actually, let me start with the Honorable member in the extreme corner. The truth is we are providing a service well above what a regional referral hospital should offer. It is not only dialysis. As I mentioned from the beginning, we have 41 units, and many regional referral have actually almost half of that. So the problem, it cuts across. You find that we are offering, for example, ear, nose, and throat surgeries. But by the nature of us being a regional referral hospital, we cannot access what should be consumed in that area because that one is already designated for a national referral. And it cuts across very many areas in cardiothoracic surgeries, in neurosurgery, in urology, dermatology, high risk, very many things we are running. So
before you continue, does it mean you are now operating those other units illegally? Because if you're not given the permission to do that, then why are you doing it?
Yes, accounting officer.
Yes, it is not illegal. As I said from the beginning, this is a teaching hospital. And all these units I'm mentioning, actually the university has courses, the postgraduates there. The truth is, the majority of the workforce we have are students doing their masters in that area. That's the cushion we've enjoyed as Mbara Regional Referral Hospital. So dialysis, yes, we would have loved to do it, to have our direct requisition from National Medical Store. But it is a regional referral hospital. It was out of Kirudu's wisdom. It was congested. Yet we have trained personnel. We have nephrologists from the university side. We said, we started with 2 donations of dialysis machines from Italian friends. We approached Kirudu. We said, we have specialists, we've got machines, or we need our consumables. They found it so easy to do that such that we decongest their area. And that is what we've been doing.
So Kirudu is the center of excellence for dialysis. What is Kirudu in here? What is it coming that Kirudu? Is it the National Dialysis Center? What's it?
Yes, thank you. Certainly some details I may not be aware, but all we know in this country, it has been the National Referral Murago and also Kirudu that we are meant to offer dialysis, and therefore they are the ones which can easily access to the consumables.
Accounting officer, go to page 25, item 8. I don't know, note of your response with this report of the Auditor General on this table. Item 8, the number of condoms procured and distributed. You had planned to procure 50,000. You only procured 24,000. 25,000 were not distributed. You said NMS did not deliver as planned. Don't you think you contributed to the spread of HIV in that area, and you denied some of your clients opportunities to enjoy their social liberties?
Yeah.
Yes, Honorable Susan.
Last year, it was in the newspapers, Mbarara was regarded as the district with which had highly infected people with HIV. Mbarara was named to number 1 last year.
So, accounting officer? Yes, Honorable Sarah.
I just wanted to find out before the accounting officer comes in, because these are planned activities for which money was
spent,
was released and close to almost 100%. So when I see partial implementation, how comes all the money was utilized and yet activities were partially implemented? I just need to understand, because when I look at diagnostics, for example, you had 227 million shillings, of which the warrants were 226,750. And that leaves you with just a small 250 to make it. So it's 99.9% released. Now, when you look at the implementation, partially implemented, for example, the X-rays, I'm sure there are films or whatever is involved there which you did not utilize. The ultrasound, partially implemented. So these partial implementations, how comes you have partial implementations where the money was released to near 100%?
Honorable Sir, as he makes a response, yes, Honorable Cooper, Elijah, as you also introduce yourself. And actually, other colleagues who came in after we had introduced ourselves, they've not just come in. They came in slightly after introduction. They should also introduce themselves. Whoever didn't introduce, please do. Beginning with the Honorable Elijah Okupa, senior citizen.
Thank you, Honorable Chair. My name is Elijah Okupa, representing the people of Asilo County, Serere District. I've just issue that you raised about the condoms. I just want to find out, because you received 70% of the money, but you are able to do 52%. I would have expected it to be rhyming. What explains that? Thank you.
In the same vein, Chair, about the condoms, now you mentioned NMS and condoms, and we've known condoms and HIV prevention has largely been with the partners and civil. Now, that come into play here, that NMS gets from the, when you get from the partner, they give NMS to distribute. What happens? What's the interplay between the CSOs, partnerships, you as the service providers, and NMS in regard to the condoms and other preventables for HIV? Thank you.
Honorable Sarah, on the matter that you raised, we still have a prevailing challenge. Through the response of the accounting officer, he said this information that we have is a little insufficient because of the EFR system, that the auditor only relied on the digital information and did not look into the paperwork. That's why I was trying to look at the other table to find out whether the auditor that handled Barra Regional Referral Hospital is around to give clarity on the issue that they have raised. And Salongo, kindly pick interest in that as he does make a response. Yes, Honorable Sarah.
Chair, I do take note of the AFIA, the E-AFIA, and those ones are clearly indicated. The management response states so. But there are on other cases where, for example, you're supposed to have ECG tests carried out of 688, only 106 were done, partially implemented. Staff who was working there retired, and it took time to replace him. So I'm asking, so where is the money?
Yet you spend all,
yes,
and activities were not.
Those ones where there are documentation issues, they are clearly indicated as documentation challenges after introduction of E-AFIA. But I'm talking about these others where there was a full release of funds and yet activities partially implemented. And then the money was fully spent.
Accounting officer.
Yeah, thank you, members. Through your chair, allow me to request my colleague, Dr. Manzi, to shed light on these concerns. Thank you.
Thank you, Chair. The beauty with some products like, let's say, condoms and maybe the ARVs, these are items that are provided to NMS by partners. And these always, we never run out of stock of them, unlike these other normal essential medicines, which affect our budget. These do not affect our budget. So whatever we plan, ideally what we have always been planning is what is delivered. If let's say you plan for 600 tins of TDF, that is enough for Vala.
Doctor, you don't have to meander. We are asking specifically, go straight to the audit query.
Yes.
Planned versus variance.
For that year, we planned for those 50,000 condoms, but was unlucky that year we faced a challenge of they were not delivered.
You said they always have in plenty. Why did they deliver?
But it was only that year that we
No, you know when you come for issues of audit, we don't look at only that year. Remember, you are dealing with lives. I told you, this is criminal. Because you contributed to the spread of HIV, you denied the people their social rights. You see? So you cannot just say, because that year, only that year. No, this is a service that you are supposed to render. So because for you might think because we are talking about condoms and you take it light. No, this is an item that is essential. That is why you planned for it. So as you make your response, don't refer to other years. You refer to the year under review and you tell us what happened after failure to deliver these planned items. What did you do as an entity? Because you have reasons. In any case, why did you plan for 50,000 condoms? What was your basis?
And also, Madam Chair, as rightly said by Doctor, I want to believe that these are supplies that are given to NMS or donated by partners. But here they are costed. Here you
said yes.
Yes. Here they are budgeted for. Can you also help us appreciate what happens there? Are you paying for them when indeed they are being donated to us? Can we reconcile that?
But still getting back to my issue, because you got the actual
at 70%, but you are able to 152%. Why that varies? They should be at the same level.
Yes, Doctor.
Thank you, Chair. If we are to look back, if you are to see in that year, USID started having challenges. We started seeing things like withdrawal and all that. But before, we used to get almost
Doctor,
all the
speak to the year under review. We are not interested in the before.
The one of,
we are speaking
the one
for
of Trump just
the
started
year under review. We are speaking to your work plan, versus failure to provide this. That is what you should speak to. Don't go to before, after.
No. Why I refer to before is that we make this year's plan depending on we predict the consumption of this year. We plan for this year using past data to use.
And no
data.
objection on that.
Yes.
We are asking, why didn't we receive the 50,000? Those are the reasons we should give.
We presented the order to NMS, and NMS delivered less than what you had ordered. So,
Chair, NMS has to and then here, do the partners give the money to you as an entity, or they give it to the central government budget, or the NMS? What happened? The money changes. NMS.
Actually, for us,
NMS.
when it comes to facilities, when it comes to ordering, first we do not even interface with the money. For us, we just send orders online, and NMS just brings the items.
My question still stands. For the variance of the 50 billion and now the 3 point something, NMS will respond. Mine is on the actuals you received vis-a-vis the output. 70, 52. Why?
I haven't gotten it clearly.
Let me take you back to the appendix on page. The output budget was 5.1 billion. The warrants page of the Auditor General's report. Yeah, page 22 on 3. Are you seeing the output budget was 5.1 billion? The warrants were 3.6 billion. Expenditure is 3.6 billion. Number of condoms, of course, the audited amount was 50,000, but the actual was 24. So you can see the money, the actual expenditure is 3.6. And you get, it's more than a half, it's more than, but your performance here is 52%. That's why I'm asking. That's why I'm asking.
What did we use the other money for?
Yeah, why is it not rhyming? Because you should have also, the distribution here should have also been at 70.01%. So the difference between 5 billion and 3.6, NMS will explain.
Please.
Who is giving misinformation? Auditor General or us?
Beyond record.
Beyond record. You tell us who is giving misinformation.
I can say...
Pull the microphone closer.
I think the Auditor General captured a wrong information to assume that all these 5 billion related to condoms. No. All this money is for G2G activities, of which condoms were a part. So it's not true that all the 5 billion went to condoms. No.
Madam Chair, some information.
Yes, yes.
So where did the other part go?
No, we have Chair had guided that when we come to G2G, there are various activities.
Because I know.
No,
I'm asking you, yes, because you are the one on the ground.
Yes.
If you say Auditor General is misinforming here, you should be having you who is on the ground, yes, on your fingertips, what the other one is. Because I know the down HIV/AIDS has also its issues. Because I think that is what always goes with you said. Donor money.
Yes.
But I am specific on this one. This one is specific on HIV/AIDS. I mean on condoms. if you looked at that column and you take
Actually,
it. So,
Chair, that's what I wanted to clarify. If we'd go into the details of the work plan of G to G, would specifically pick out the money which was allocated to condoms coming from G to G. That's what I'm trying to give to you. And speaking to this, you remember G to G, if you look at the budget 5.1 and money warranted 3.6, you know G to G, it crosses the financial years. This is US.
Excuse me.
Yes, sir.
That's what I'm saying. The difference between 5 and 3, leave it.
Yes.
We are seeing this one specifically allocated for the condom, the 3.6.
No, Honorable Chair.
Maybe the Auditor General can help.
No, the Auditor General did not make any mistake.
Clarify. Because he's saying it's a mistake. Can they clarify?
If you look at that table, the 5.1 and the 3.6 have a number of activities under. It is very clear.
Yes.
And also when you go to table 1 showing the summary of analysis of the entity's budget, it is very clear that that budget of 5.11 billion was for G2G. So let's not spend a lot of time on that. So this money was not specifically for condoms alone, but for these other activities that are underlisted. Yes. So accounting officer, it is very unfortunate that you did not bring out this matter at the time of the exit meeting while we were interfacing with the Auditor General, because we have misleading information, especially in the areas where we talk about the system. You called it, what's the name that you gave? The AFIA? The EAFIA. Because, you know, if you fail to give sufficient information on the activities that were executed, that means we as the accountability committee cannot ascertain whether you appropriately used the money that was allocated to you. Honorable Sarah.
Chair, I do appreciate that the 5.1 billion was not only for condoms, but it related to a number of activities which still show a lot of wastage, surely. That we can have 3.6 billion being given to us by USAID, and it is 1 for procuring condoms, 2 for CSOs and service providers being trained, for health workers and public-private sector trained in integrated management of malaria. Yes. Now, when you look at this, Chair, specifically on HIV, on item under 3, page 22 is where I am. Number of CSOs and service providers trained. The indicators, the activities, 20. The actual, 0. But they've written they are fully implemented.
This is the auditor's analysis, and I believe there must be an error on this one. It's
I remember during the exit, all these submissions were done, but in most cases, Auditor General, there are queries which he keeps in view to follow up in the following financial year, and specifically to G2G. You know, it crosses 2 financial years, and most of the last part is done in the first quarter of our financial year. So when you look at this,
you say your title is a doctor.
No, I'm a senior accountant.
You are a senior accountant. Senior
Yes.
accountant. When you are making a plan for a financial year, all that is done is for that financial year. It might spill over, but whatever is supposed to be handled in the subsequent financial year is brought up in the budget for the next financial year. You want to mean because it's a G2G, all the activities are put here as a lump sum?
No, actually, this is, I think maybe we have to go back to the budgeting committee. This is what we had wanted it to be, that specifically for G2G, we only budget for 3 quarters, because it is what we handle from 1st October to 30th June. Yeah, because for them they end in September.
Yeah.
But in the committee, because this is the fact when you look at the budget, you can even access it here. You'll find all the budget, this 5.1 billion, is for the entire G to G. But ordinarily, we perform 3 quarters. And in the first quarter, when you look at the warrants, you'll find in Q1 of our financial year, under G to G, we'll have more money because of those activities which cross, and they are funded in that first quarter of the following financial year.
Yeah, that's
Yes,
that's why I was asking, can the Auditor General help us appreciate this more? Yeah. Yeah, since they now speak the same language, can we now hear from the Auditor General?
The person that handled this entity is not with us.
No, not necessarily, but the others, if they are here, understand the things. They should be able to relate how they operate here.
Arnold, can you make a response to this? Do you have the capacity to? Salongo, did you get the question clear? If you've just walked in, excuse yourself.
No, yeah.
Before, yeah?
Yeah.
Okay.
Before I went out, there is some information that I wanted to put forward. To begin with, the auditor was not, I don't remember the word that was used, to describe the fact that he was not, yes, to describe the fact that he did not do what, or he captured this issue in the report. Madam Chair, what we should note is that the fund, nearly all the funds that were planned were almost given. And
now,
apart from a few, but there was provided funding. Now, when you look at like the 5.3, is it 5 point something billion? 3.6 was given. But now, when you look at the activities that were done, there were gaps. There were gaps. And if we look at page 22, page 22, the one on the top, 243 was warranted. Let me say 243.7 was budgeted. It was warranted, and it was spent.
100%.
100%. But when you look at the activities there, they budgeted for the first activity 21,112. The actual was 18. The second one, 125,840.
Salongo, we've taken note of that.
Yes. So, and there are other areas when you go through the whole, table, where you find some overperformance. Now, the overperformance means that they have used the money which is meant for some of these other activities where they underperformed and used it in those other areas, which means there are diversions within. And the auditor bringing this issue is to bring it to the attention of the members of the Accountability Committee or members of Parliament that there is this challenge. And when you look at the response given by the accounting officer at the time of exit, he brought in the idea of NMS not delivering, and he brought in the idea of issues with the e-AFIA, implying that for those areas maybe to be rectified, then he has to bring
Accounting officer, do you get that clearly? That save for the funds that were utilized in the subsequent quarter, even the 3.6 that you received, you used 100% of this money, and where some activities remained partially implemented. And when you look at item 2 of 125,840 patients, you only had half. And you had a variance of 58,127. Partially implemented, but the money was spent. Do we want to mean that for these activities that are partially implemented, their funds were used to implement other activities where you excessively performed? Or you overperformed? Do you want to mean that? They are there on page what? 24. Please do.
To speak more.
No, you. That's why you are here.
Yeah. Because I'm always fully involved in budgeting and even execution. You see, during budgeting, all of us, even the Parliament, we have the system that is used by Minister of Finance, the PBS system. And when we are reporting, the system, it interlinks with IFMIS, yeah, at Accountant General. So the that system of Minister of Finance, PBS, it picks actuals from the performance of Accountant General. How much have we paid? Now, Minister of Health introduced IAFIA. It reads into these two systems. So it's what I was trying to say earlier, that where we had raw data, specific, and it's unfortunate that we did not come with the details from the records department. Yeah, you would get that where we had all these shortfalls, we presented these details to our colleagues at Mbarara Auditor General's office, and they appreciated, because the system in those sections, when you go to those areas, you'd find it was capturing or actually nothing. But at performance level, when you are capturing your quarter 4 performance level, budget performance, because it reads into that system, it will capture 0 or 2 or 3, and you cannot enter it manually. No, it has controls. It's what all these, it's not that we spent the money or we diverted it. No, it is this the issue of the systems now which have been synchronized to speak into each other. Equally like diversion, like NIRA, you know, when you are blustering the HR, it is the same thing, because now NIRA also reads, it is integrated with HCM. So any information which is not as per NIRA's capture, it will reject even when you pay. On the system, it will reject that data. So equally here, this is, Chair, what I was saying, that the performance was okay. We tried to argue it out, but they said, let's keep in view this query underperformance, and then we check in this, the last year actually.
So you want us also to keep this in view?
I think so. Yeah,
because it looks as if you are indirectly giving a proposal that, you know, Honorable Chair and members, please keep this in view.
Yeah, actually, you will see now the performance on these indicators and planning. You will see a shift has, because almost our quarter 4 report has been done.
Honorable colleagues, the Office of the Auditor General will do this verification, because we seem to have challenges in sources of data.
Yes.
Sources of data, and for us, we are not auditors. So we shall push it back to the Office of the Auditor General to help us synchronize these items, so that we come out with a true picture of how Mbarara performed in regard to expenditure of the funds that you received in the course of that financial year. Otherwise, short of that, you cannot account for the money that you received under this financial year that is under review. So, honorable colleagues, I do request that we are not keeping in view, sir. We are going to verify because his proposal was that we keep in view, but we are going to verify, the auditor is going to verify, and we've not made a resolution on this item. Honorable colleagues, now let's go to 2.13, delivery of services from implemented activities. We had this construction that had a delay of 6 months, 3 months. Give us the update. The construction of a 32-unit Mbara Regional Referral Technical, what is this? Construction of a 32 units. Was that the staff unit? Was it constructed by UPDF? There seemed to be a contractor here, MOPA Technical Services. How far? Update us on the progress. Have you completed the project?
Yeah, thank you. Through you, let me request our principal hospital administrator to clarify.
But you have an update on that accounting officer. We should not.
Yes, I know.
Please do.
Thank you so much. Yes, it is not yet completed. It is actually it is 32 housing staff quarters, and it was a multi-year project. Unfortunately, since 2003, 2004, there has been no more release of the money for that project.
Since 2003, 2023, 2024?
Two actually. Yes.
22, 23. Now, I agree with you that the hospital administrator is going to give us some history about this construction. How much was the contract value? Physical performance is at how much versus financial performance? You know, honorable colleagues, this is where we find idle capital. You have money invested in something and it is left there. We need to know how much was invested and physical progress versus financial. Proceed. Properly use the microphone, sir.
Administrator, if I think we have financial statements.
We do have.
Yeah. If you go to page 6 of financial statements, under the commentary of the accounting officer, page 6. Yeah. The budget allocation, I mean the contract amount was 5 billion. This project was awarded in 2020-21 financial year.
It's not 5 billion, 5.7 billion.
5.7.
Because you are saying 5. That rounding of yours is...
in accounting you can...
No. I've also done...
Thank you.
I've also done figures. So you can't round 5.7 billion to 5 billion downwards. You could have, if you wanted to round, it would have been 6 billion.
Okay. Please go ahead.
And the budget is an estimate.
Accountant, go ahead.
Yes, sir. Yes, sir.
Let's proceed.
Yeah, you can see in that table, yeah, and in different financial years, you can see the money we received, and as at the end of that financial year, 2022-23, we had received 3,750 million, and the balance since then up to date is 1.96.
1.96 billion?
And since that financial year up to date, I think under development for all referral hospitals, there is zero.
So government of Uganda has spent 3.750 million. Billion.
Yes.
Lying idle.
True.
In something that was constructed in Mbarara Regional Referral. What was it supposed to be?
For housing staff.
Housing staff. Staff houses.
32 units.
32 units. So to date, no more funding. What communication did government make?
Maybe, Chair, before we get it, what's the actual performance?
Physical.
Physical performance.
The performance is around 78. This is the procurement officer. Around 78.
Around 78%.
Yeah, because they received 65%.
So that means you have a shelf?
So if they have moved.
Yeah.
You have a shelf. Does it look like this one?
No, it is far better.
It is better than...
Yeah. We are actually Even when you look at the photos. Well,
so it is roofed, plastered.
Even the doors fitted.
So what is missing?
It is actually the last part of painting.
No, 1.7 billion cannot be just final touches. It is 1.9 billion, cannot be just final touches. I know it's a colleague that was giving us final touches. So I want, because, you know, this is very embarrassing. Government starts on a project. Meanwhile, you have medical staff moving up and down. I don't know, where do your staff sleep?
No, they survive on their own.
You see? So this is very, very unfair of our staff in Imbara. You have a structure where you've invested a lot of money, lying idle, and government, have you been allocated any money this financial year, 25-26? Honorable colleagues, you know, there are things that we cannot hold on as wait for the Treasury memoranda. This one cannot wait. This might be borrowed money. We are paying interest on an item that is not serving the people. So this is a waste of resources. So our clerk, take note, among the items that must be seriously discussed with the stakeholders that we talked about is the issue of the 32-unit staff houses in Imbara Regional Referral, where government has refused to give more money. You see? So if you invest money, eventually you pull out. This is very unfair. The staff of the regional referral are still renting, and they look to be comfortable and happy. Director, you are very comfortable with this situation.
No, I'm not.
Have you written any letter to the ministry to really update them about this situation?
Yes.
Now, you are going to give us all the letters that you have shared between Imbara Regional Referral Hospital and the ministry. All those letters, those are going to be among the submissions that you are going to make.
Chair, as we discussed that, you remember where Parliament was accused that Parliament has taken money. I was in the budget committee. These were part of the projects we had reallocated money to cover.
Can you imagine?
Unfinished projects. But then some people from finance went to the president that Parliament has eaten money, has taken 750 billion. It was money for ambulances, money for finishing the structures, money for health center trees. So, as we deal with that, let us wait to deal with the finance people. They are the ones who don't even, it's not even these hospitals. We need to deal with the finance.
Actually, in addition, I remember that reasoning by the chair budget that we have so many idle investments out there. Why don't we have them completed? You have a health facility, phase 1 done, no phase 2 funding, you leave it there. So somebody comes out and says, you know, because this is going to somebody's constituency. But this is Uganda.
We had removed money from the treasury operations to have all these projects, especially
completed.
The health and school, to be removed. But some people think
750 billion taken to, is this the one that you are distributing in the ghettos? Taken to the ghettos and you refuse to, Honorable Nekesa, let me first complete my point. We have the 750, a moment. The chair must be heard in silence. Okay, you can, General.
Thank you, Chair. Without the committee delving into ghetto and other policy that we are also accountable to as a Parliament, because I think I'm in the Secretarial Committee of Health, so I know what happened in that, and the fact that the Parliament was involved in having this universal policy of capital development put a halt. I think we cannot. Put a I mean, for the health facilities, it came through Parliament.
Put a hold.
I mean, it happened. It was announced on the floor. That's Parliament. So we are all accountable for that. We can't point fingers now and get the entities, ma'am.
Doctor, I know you want to defend the government, but this is in the budget committee. That's why we have reallocated money.
Back to the chair. Back to the chair. We have never, as Parliament, passed a policy that we hold capital development in hospitals. We've never done that as Parliament. I've never heard of it. So kindly, that is off record, and Doctor, let's not submit on that. As PAC, we have not made any submission that we are part of this mess. No. PAC is not part. We have never passed a policy of stalling capital development money. Actually, our interest as MPs is to have capital development everywhere, because this is the only way you can serve the people. So if the executive sat somewhere and the executive made resolutions, that is theirs. And that resolution has never come to Parliament. But I doubt whether there is a people's parliament that can pass such a resolution. So, you know, when we have unfinished projects. So, doctor, for that one, I'll say it's off record, and this is not parliament. That's how, not how the People's Parliament can behave. So, honorable colleagues, we take note. We are going to sensitively handle this matter. Mbarara Regional Referral Hospital must be allocated money to have this facility completed.
Thank you.
Non-negotiable. Thank you, honorable members. Let's do proceed. We are looking at findings from the hospital service delivery points. We are going to handle this. We need to hurry a bit because we have plenary today. Stockouts of essential medicines. The Auditor General noted that some of the stockouts were up to a period of 10 months. 10 months, a hospital like Imbara, who is said is even at a level of qualifying to be a national hospital, spends 10 months without having essential drugs. Accounting officer, what's the reason?
Thank you. Please, Dr. Manzi.
Thank you, Chair. Routinely, as Mbaro General Referral Hospital, every year we do a needs analysis to ascertain what is our actual need. And if we have to do an average of 5 years, we realize that our actual need was 54 billion. And we have already shared this data with national medical stores. Actually,
54 billion for
essential medicines.
Essential medicines,
and
yes.
health supplies to cover the specialized and the super specialized services. But our budget is around 2.8 billion. And that 2.8 billion is what is allocated to us, and it's what we spread thinly across all the items that we receive. Some may find that at the beginning of every year, we have to make sure to plan within the 2.8 billion. Now imagine that the variance between 54 and 2.8. So that alone.
Honorable Susan, compute which percentage is that? 54 billion versus 2.8. We need to get that percentage.
Yes.
So, honorable colleagues, do we have to spend more time on that? We take note that Imbara Regional Referral Hospital is given a very meager budget when it comes to supply of essential medicines. We need to take note of that. Could be this is done out of the other reasoning that you even offer services that are outside your scope?
Actually, Madam Chair, it is so hurting that we have these specialized and super specialized services, and we have clients who demand for them. But when we're making an order, we're restricted to something called the essential medicines and health supplies list, which all other regional referral hospitals are supposed to order drugs to. Yet we are offering other super specialized services like the neurosurgeries and all that. These require specialized medicines, and these are not provided for by this list. So each time we would push for these, we always told, no, this is a monopoly for the national referral. So surely, that's why.
So, honorable colleagues, we should take note that Mbarara is supposed to be handled in a unique way, because it's us who say that Kampala is congested. Mbarara is trying to help us handle some of the other, patients that side, and you cannot give the necessary medicines to help them, execute that mandate. So for me, I think as we do make discussions with the key stakeholders, Mbarara should be part in regard to whether they elevate their mandate. Government must have a special discussion in regard to Mbarara, because as people need the service. We need the services, and we cannot underscore the contribution that they do make to provision of basic services medical to this country. So we take note of that. We are not going to really waste a lot of time on it. So we shall handle it as we do proceed with the discussions that we shall have with the relevant stakeholders. Then when it comes to radiology department, the X-ray unit, the auditor notes that during the time of inspection, it revealed that the X-ray machine had not been operating for the last 3 months. What happened to your X-ray machine, doctor? Dr. Manza, are you the one to respond? I don't want to.
No, it's okay.
If they want to proceed, please do.
Thank you. This is a common information to all of us. We've had an old X-ray machine that has served for the last 30 years. And it kept on breaking down. Eventually, it was condemned. That was actually...
Doctor, explain to us, what does an X-ray machine do? So that even the lay person can understand.
Yeah, thank you. An X-ray machine, it is a machine that uses actually ultraviolet rays. And the commonest investigations we've seen it clearly looks at the bones and the other tissues, the soft tissues, but mainly the bones. So every time you hear that a patient is suspected to have, for example, TB of the lungs, then one of the special investigations is the X-ray of the chest, which will show us that we have actually wounds or perforations in the lungs. If I get fractured today, the minimum of first useful investigation is an X-ray. It will show the other fracture in the bone. So that is X-ray we've been having.
So what happens to people who come to Mbara and they need X-ray services?
Yes, we are still stuck with the people.
Up to date?
Yes. It is only, members, it is only 2 weeks back when we received the good news that the ministry has got an X-ray, actually a digital X-ray for us. The team is there to make pre-installation assessment and also to plan and take away the old one. So I'm very happy that very soon that is a service.
To date, for how long has Mbara Regional Referral Hospital stayed without an X-ray machine?
It is now actually 2 years.
Doctor,
2 years.
2 years. 2
years? Yes.
Mbarara Regional Referral Hospital, spending 2 years without an X-ray machine. How much does a private operator charge for an X-ray examination?
In common places, yes, in Mbarara, non-sophisticated one is 300, not 300, it is actually 35,000. 35,000. It can go up to 150.
But Chair, I would like the county officer to tell us, to the committee, what happens if you're to get an X-ray. Is it off shelf, or is there a procedure that what makes it long to acquire one, or is it as easy as go across the shop in wherever and get it? What's the detail there?
Thank you, Honorable. We've been actually pressing, and every time we actually in the physical visit to our offices, they tell us there is a procurement process. Please be patient. Please be patient. Until recently, when we got good news.
A role of the Atomic Energy Council in this that can also delay that this.
Honorable colleagues, we're not going to look too much in the delays, but we have to note that the referral hospital has spent 2 years without an X-ray machine. There is no process that can take 2 years by whichever standard. So because doctor wants to seem as if the process was in progress. So honorable colleagues, we take note. Mbarara Regional Referral Hospital remained, 2 years. Actually, for to date, they don't have. Yes, honorable.
Chair, just something that I wanted to raise. This is a regional referral that is supposed to be upgraded to a national referral facility. I do not think Mbarara in its state should have one X-ray machine.
True.
And reading through the audit report, it clearly indicates that the X-ray machines, implying there were more than one, I don't think they all became non-functional at the same time. You had only one? Sure? Yeah, but in looking at the number of patients that you handle, you shouldn't have just one X-ray machine. You can have one big one, and then another, of some level, yes.
Yeah, that's very true, Honorable.
Which you should have.
And
but,
we are okay.
Yeah, but just hold on. And that takes me to my other question. As a regional referral hospital, should you continue relying on the center for procurement? Can't you, as a regional referral hospital, now considering that you have the teaching university next to you, find other alternative means of having an X-ray machine? Even if you charged, I don't think you'd be charging 35,000. As a patient, I would feel happier coming to a facility. You even have the private wing, by the way. You have a private wing.
Do you have an X-ray machine in the private wing?
So why should you have the private wing, mixed up with the general wing, and then you cannot have the services the other side? If I came to a hospital as a patient, I would be happier being told that this X-ray you know, the X-ray services are not for free, and you asked me to pay 20,000, then as a patient coming, picking, you have diagnosed and said I should do an X-ray, and then I have to walk out of the hospital to another facility.
And it's
that's another day wasted.
A distance
So
away from
why don't you have an X-ray machine in your private wing as a regional referral hospital?
Doctor, why don't you have, yes, Honorable Kupa Elijah?
Because I'm sure the charges will be less.
Chair, me, the Honorable, like we say, was former Minister of Health, Minister of State for Health. I'm just wondering whether it is not the law that is pending or halting them to do that, because I know most procurements, you must follow the procurement law and the guidelines. If it is so, maybe that's where we need to come in and say, I think for regional referral hospitals, if they have the money, they should be able to, they should be allowed to procure, especially. But even with the private, because even the private, when they get this non-tax revenue, it must come back to this, it must go to the center first. It must again go back to the center. They cannot still spend it. But to me, my concern and the worry is how, this being a teaching hospital, what has been the fate of the students who completed their year? During these 2 years, if they are to do practicals, because they are going to the hospital to do practicals, those ones who are going to do an X-ray, how has it been handled? So so what type of quality of students are you going to churn out? This is where government should really be serious, because there are some things which can be delayed in order to others move. I was telling my sister here that even the PDM, they can delay the PDM to be given, and let the money go there and let us have at least X-ray. Because someone will not die because he has not received the PDM. But let us have, someone can die when there's no X-ray machine. Yeah. So we make a strong recommendation to this effect.
I'm telling you, you are looking at we shall not be here to argue about PDM and these others, but you must know that prioritization is very important.
What is life?
You cannot miss out on
and
the
quality
basics.
of the people who churn out.
And Honorable Cooper, doctors should know that government has signed the social contract with the people, and provision of basic services is mandatory. When you go to the Constitution under the national objectives and direct principles of state policy, it is under Objective 20. It is mandatory that the state shall take all practical measures to ensure the provision of basic medical services to the population. So it's non-negotiable. That is why, Doctor,
it's in the perspective that even social transformation is part of the social contract that you can't undermine and go forward.
Doctor, let's not just argue on this. Health is life. You cannot argue about life.
Yeah, it's
you cannot. And you cannot fail to give, you know.
If someone does not get PDM, you will not die.
Honorable colleagues, access of microphone is after permission from the chair. I have ruled. So, honorable colleagues, we take note that Mbarara has no X-ray, and the one that they are yet to get is one. The population is big. Yes, we need to look into this. It's not a matter of arguing. Colleagues, look at the common person, the one-inch who cannot afford some of these.
Chair, even you, because if you are sick, even if you have money, but you have been admitted in Mbarara, but now you need X-ray, even if you have money, you must be moved, and you may be too weak to be moved to that private thing. So it's not about just only ordinary person.
So, honorable colleagues.
Madam, I need protection.
No, you are very protected, and
I think I've touched the wrong button of PDM.
No, she must have the energy to listen to these, some of these, you know. You must get used to listening to the concerns of the people, no matter the political parties that you subscribe to. And we are here basically to serve the nation, not serving political parties. Honorable colleagues, take note of the CT scan. Doctor, the author noted that, I noted that the Ministry of Health delivered a new CT scan machine. However, this was not in use because of lack of essential accessories to facilitate its full functionality, as illustrated below. Honorable colleagues, our dear team from Bara received a CT scan that has remained idle. You will tell us for how long? Because of lack of accessories. Doctor, please.
Thank you, Madam Chair. To inform you now, it's fully functional.
how many years did it spend without, serving the people?
I think it cannot make they're just a few months because we kept on.
Few months is not time. Be specific, doctor. You are, when you make response, as you make response to some of these items, a CT scan means a life to somebody. So you have a machine that was brought, it lied idle for some period of time. People were underserved. So as you speak to some of these facts, be factual.
The good news is that we had an old one. It was helping us during that time.
You proceed. Now let him proceed.
Yes, the good news is that we had an old one, which is still functional even up to today. So it was helping us during that period of time. But we kept on writing to Ministry of Health, and we kept on writing to ElseMed, and later who came later and rectified the problem.
We were asking for the period. For how long did this remain idle? 6 months, doctor.
Not sure.
You must be sure. These are your items. You must be sure. You have them kept in hospital garages. Honorable colleagues, remember a scenario that we had in Masaka Regional Referral, where they had ICU beds kept in a garage for 3 years. So this is idle capital. Meanwhile, a ministry buys a CT scan, no accessories, it is put there. So the reason as why we come out to bring out these issues is to avoid these incomplete supplies. How do you buy a CT scan, then you don't put accessories? What is the essence? If you don't have money, don't buy. No pressure, no what. And you'll find these being dumped in so many places. You rather buy a few, complete, and use them.
But even when you procure a full unit.
Procure a full unit.
The supply should provide for everything.
Madam Chair.
Yes, Honorable Saz.
Yes, Madam Chair. As an ordinary Ugandan, I want to know, without essential drugs, no X-ray unit, no CT scan. Now, what qualifies Zimbabwe to be a referral hospital?
It is a poster. They have a poster that indicates that Mbara is a referral hospital. You say they are in a high dependency unit. For me, I qualified it to be. So, honorable colleagues, the operating theatre, we take note that the auditor inspected the main theatre and noted the following. The hospital has a theatre operating of 8 rooms, but only 6 were operational at the time of inspection. The 2 rooms were not operational because they lacked the basic equipment and operating tools, such as the operating table, anesthesia machines, operating lights. Mwetaga bulb, you need a bulb, eh? Operating lights means these ones, eh? Operating and operating instruments, among others. A number of equipment had machinery breakdown. They could not be repaired. These included water heaters, anesthesia machines, operating beds, drip stands, trolleys, weighing machines for babies. So, accounting officer. Mbarara City. No, these ones qualify to be Zimbabwe district local government, because when somebody mentions that you are in a city, I mean, even Zimbabwe is better than you. You know, when one listens to the land of milk and honey, then proceed with your answers. So, Doctor, proceed.
Yes, thank you, Chair. If you had seen most of the equipment that we are having were equipment that were given to us at the inception of the building. So these have been used over that period of time. I think that the building was around 2000.
It was 2012.
2012. So these have been used since 2012. And secondly, if you had to see the number of operations we handle, there are quite very many. So some of these equipment even don't rest. So that's why we see we're in such a situation.
So we've been talking about the issue of placement as opposed to outright purchase of equipment. And I want to hear from the hospital team whether you do not think that the placement option is a better one, because then the challenges of accessories of some of these things would not arise. Because when you look at the CT scan, for example, they had a new CT scan placed, procured, but not utilized. So if you opted for placement, then the owner of that equipment would ensure that the necessary supplies or accessories are available. And if there is any mechanical fault, it's their duty and responsibility to ensure that they, as fast as possible, repair this machine and then remove it, even bring another one. Wouldn't that be a better option that regional referral hospitals should opt for, as opposed to this outright purchase of equipment, but also considering the changing technology, because this technology is changing very fast. You procure equipment today, the next 2 years you may find you don't have supplies.
Dr. Manzi, before she comes in addition to that, Dr. Manzi, would you say something about your staff, the biomedical engineers? Do you have part, is it part of your team, or do you again transact those from elsewhere to do the services and maintenance of equipment? Thank you.
Thank you very much. Yes, it's unfortunate. Unlike other regional referral hospitals, Mba Regional Referral Hospital lacks a regional maintenance workshop. Actually, we rely on the university students actually to help us, plus the lecturers to help us do the maintenance of this equipment. Then, concerning the placement is possible for some equipment, and for some other equipment it may not be possible. Mainly, I can give an example. If I can give a basic tool, like maybe a laparotomy set, that one we have no option as hospital, we have to just buy it. However, the budget to buy, our retooling budget for this equipment is so small. It's around 108 million. 108 million. Even 108 million cannot even buy an anesthesia machine that we are talking about here, because an anesthesia machine costs 250 million, which means even what we have, if it broke down, we cannot afford even to buy another one. And operating lights. An operating light, just one. Actually, when we're talking about an operating light, we mean that she was asking about a bulb. It's an equipment that provides light trying to mimic the sun, because it's easier. You can easily view the smallest vessel under the normal natural light. But when you're enclosed in darkness, that can provide the light that is equivalent to the normal light. So just one light costs 90 million. 102.
So meaning we have the budget for maintenance is very limited, and even for capital development?
It's almost because if you cannot buy even one theater light, or even if you combine 2 financial years budget, you can still not buy an anesthesia machine. So which means that even what you lose, you cannot even replace it.
No, but
So
yeah,
the
this now takes me to the issue of out-of-pocket expenditure on health. Why do you then say that are your services free?
Yes.
Are they really free? If you send me to an X-ray out of the hospital, so how do we say that the services are free? Then why don't you opt to have an X-ray machine placed and charge minimally, so that Ugandans can contribute to their own health
Honorable
care,
Sarah,
instead of that inconvenience?
Honorable Sarah,
Because
really,
people are paying for health care. It's not free.
The cost-sharing policy.
really, policy issues must be also looked into. A referral hospital. This is a government hospital, and you cannot just operate as if we are in private. So, honorable colleagues, let's take note that Mbarara Regional Referral Hospital, for him, he was saying it is in the high dependency unit, but he has also now believed that is in the ICU.
No, but let me make a correction.
Yes.
Tertiary care is not free in this country. Let's be clear. Let's stop the pretense. Primary health care, yes. Tertiary care is not free in this country. So let's not talk about free health care services, even in regional referral hospitals, which provide tertiary care to patients. So let's have that distinction and be clear to the public. That tertiary care, those specialized services are not free.
And that is true.
Yeah,
everyone
so why
knows
are we pretending?
Specialized services must be paid for. But we've been looking at the basics missing. We are looking at the X-rays, CT scans, and we've not looked at specialized services. Yes, Honorable
First of all,
Silas.
First of all, to introduce myself, and also apologize to you because I came in a little late because of government work. My I'm Silas Algon. I'm the MP of Kume Municipality. Madam Chair, nearly all over the country, we realize that most of the staff of our health facilities intentionally do not want to provide for the budget for maintenance of equipment in hospitals. For the reason that most of them are operating this equipment for commercial benefit. That one we should not hide away from. And if I'm not mistaken, one of these people are actually running that kind of business. And that's where the problem is. That is the crisis we're having in the country.
Thank you.
Yes.
You, Honorable.
So before you cut me short, the microphone is still on. Madam Chair, I want to believe it is very important that Mbarara shows us the maintenance budget that they really had tried to put it there in 2023-2024. Tell us how much you had budgeted for, then government rejected or parliament rejected and threw it away. They will have known that you were serious. Yes, because that is the crisis we have. They intentionally don't want the equipment to operate because they have to benefit from that.
Honorable colleagues, we take note of Honorable Silas's observation, but Honorable colleagues, I think the allegation might not be true because maintenance of equipment has been a challenge across board, not even in the medical sector alone, but even the equipment for your roadworks. It has cut across maintenance even for roadworks. So yes, Honorable.
Even if it was true, these people cannot buy for the hospital. If assume medical director has money, he cannot buy to put it there because government has failed. He can only do it for in the private thing, and in a way, he still can save life.
True.
But by that, I'm not saying they are doing it. But if it is something is happening, there's a vacuum, there's a gap. That's how people come in. That's how people come in. But the most important thing is for us to press government to provide money for development expenditure and for the maintenance of this equipment. I think that's the bottom line.
Very true. Honorable colleagues, we take note, and the accounting officer mentioned it clearly under his response that the accounting officer explained that most of the equipment in the theatre was installed at the opening of the new theatres, and most of them were old and obsolete. This was because of the high demand for the use of this specialized equipment. So, we take note of the challenges that you do have in this sector. Lastly, the intensive care unit. The auditor inspected the intensive care unit and noted the following. And the director, take note that this is the unit where you are going to be referred as an hospital. So just know the status of the place where you are going to be taken to. Number one, the unit had a total of 8 rooms and 8 beds, but only 2 out of the 8 beds are operational. Despite the hospital has 5, despite the hospital nursing 5 patients at a time. So 2 beds are operational out of the 8 in the ICU. Number 2, there were only 3 functional ventilator machines out of the required 8 for the 8 rooms. So meanwhile, only 3 monitors were functional in the 3 rooms.